Hey there, viewers. In this video, we'll be diving into the world of supplements for erections and exploring how they can potentially boost your sexual health. We'll cover the most promising supplements based on scientific evidence, including vitamin D, folic acid, L-arginine, ginseng, and yohimbine. We'll also discuss their mechanisms of action, recommended dosages, and safety considerations. But that's not all. We'll go beyond supplements and explore the crucial role of lifestyle changes in promoting and maintaining healthy erectile function. So, make sure to stick around until the end to get the full picture of how you can naturally enhance your sexual well-being. Let's start by understanding erectile dysfunction, or ED, a prevalent issue affecting millions of men worldwide. Did you know that an estimated 50% of males aged 40 to 70 experience some degree of ED? That's right, it's more common than you might think. ED is characterized by the inability to achieve or maintain an erection sufficient for satisfactory sexual performance. The causes can be diverse, ranging from physical factors like cardiovascular disease, diabetes, and hormonal imbalances, to psychological issues such as stress, anxiety, and depression. Now let's talk about the impact of ED. A systematic review by Allen and Walter in 2019 found that the global prevalence of ED ranges from 3% to a staggering 76.5%, with higher rates observed in older men. The Massachusetts Male Aging Study reported that 52% of men aged 40 to 70 years experienced some degree of ED. But ED doesn't just affect sexual function. It can also take a toll on men's quality of life, self-esteem, and interpersonal relationships. A study by Althoff in 2002 found that ED can lead to reduced sexual satisfaction, decreased intimacy, and increased relationship stress. Men with ED may also experience feelings of inadequacy, shame, and frustration. So, what can we do about it? Let's start with vitamin D, the sunshine vitamin. Several studies have investigated the relationship between vitamin D levels and ED, suggesting that vitamin D deficiency may contribute to the development of ED. A systematic review and meta-analysis by Krafer and colleagues in 2020 found a significant association between vitamin D deficiency and ED. The analysis, which included 11 studies with a total of 44,794 participants, revealed that men with severe ED had lower vitamin D levels compared to those with milder forms of ED or no ED at all. But how does vitamin D influence erectile function? Well, it may work through several potential mechanisms. Firstly, vitamin D has antioxidant properties that can help reduce oxidative stress, which has been implicated in the development of ED. Secondly, vitamin D deficiency has been associated with hypertension, a risk factor for ED. Adequate vitamin D levels may help regulate blood pressure, thus promoting healthy erectile function. Lastly, vitamin D may enhance the production of nitric oxide, a key molecule involved in the relaxation of blood vessels and the achievement of an erection. So, how much vitamin D do you need? The Food and Nutrition Board recommends a daily vitamin D intake of 15 to 20 micrograms, or 600 to 800 international units, for males aged 19 to 70 plus years. However, some experts suggest that higher doses may be necessary to achieve optimal vitamin D levels, particularly in individuals with deficiency. It's essential to consult with a healthcare provider before starting vitamin D supplementation, as excessive intake can lead to adverse effects such as hypercalcemia and kidney stones. Blood tests can help determine an individual's vitamin D status and guide appropriate dosing. Moving on to folic acid, also known as vitamin B9. While research on the direct effects of folic acid on erectile function is limited, some studies suggest that folic acid supplementation may help improve ED severity. A study by Yan and colleagues in 2014 found that folic acid supplementation improved erectile function in men with ED. The researchers hypothesized that folic acid may enhance nitric oxide production, a crucial factor in achieving and maintaining an erection. The recommended daily allowance of folate for adult men is 400 micrograms per day. Folic acid supplements are widely available, and many multivitamin formulations contain the RDA of folic acid. However, it's essential to consult with a healthcare provider before starting folic acid supplementation, as high doses may interact with certain medications and mask vitamin B12 deficiency. Additionally, individuals with a genetic mutation affecting folate metabolism known as the MTHFR gene may require personalized dosing recommendations. Next up, we have L-arginine, a semi-essential amino acid that has gained attention for its potential role in managing ED. L-arginine is a precursor to nitric oxide, a molecule that plays a crucial role in vasodilation and erectile function. L-arginine is converted to nitric oxide by the enzyme nitric oxide synthase, or NOS. Nitric oxide relaxes the smooth muscle cells lining blood vessels, leading to vasodilation and increased blood flow to the penis, which is essential for achieving and maintaining an erection. A systematic review and meta-analysis by Rehm and colleagues in 2019 investigated the efficacy of L-arginine supplementation for ED. The analysis, which included 10 randomized controlled trials with a total of 540 participants, found that L-arginine significantly improved erectile function compared to placebo. The authors concluded that L-arginine could be an effective and safe treatment option for mild to moderate ED. The dosages of L-arginine used in studies for ED vary, with most trials using daily doses ranging from 500 mg to 5,000 mg. It's essential to consult with a healthcare provider to determine an appropriate dosage based on individual factors such as age, health status, and concurrent medications. L-arginine is generally well tolerated, with mild side effects such as gastrointestinal discomfort and diarrhea reported in some cases. However, L-arginine supplementation may not be suitable for individuals with certain health conditions such as asthma, herpes, or low blood pressure. It's crucial to discuss the safety and appropriateness of L-arginine supplementation with a qualified healthcare professional before starting treatment. Now let's talk about ginseng, particularly Korean red ginseng, which has been used in traditional medicine for centuries to treat various health conditions, including sexual dysfunction. A systematic review by Lasergang and Finelli in 2021 examined the efficacy of alternative medicine and herbal remedies, including ginseng, for the treatment of ED. The review included 12 studies on ginseng, with a total of 587 participants. The authors concluded that ginseng supplementation might improve erectile function compared to placebo, although the effect size was small. A randomized, double-blind, placebo-controlled trial by Choi and colleagues in 1995 investigated the efficacy of Korean red ginseng for ED. The study included 90 participants with mild to moderate ED who received either 1,800 mg of Korean red ginseng or placebo daily for 12 weeks. The researchers found that ginseng significantly improved erectile function, sexual desire, and intercourse satisfaction compared to placebo. But what about combining ginseng with other supplements? A small clinical trial by Najaf Abadi and colleagues in 2021 explored the effects of combined ginseng and vitamin E supplementation on ED. The study included 80 men with mild to moderate ED who were randomly assigned to receive either a combination of ginseng, 600 mg, and vitamin E, 100 mg, or placebo daily for 6 weeks. The researchers found that the ginseng and vitamin E combination significantly improved ED scores compared to placebo. The study also observed improvements in sexual desire and intercourse satisfaction in the treatment group. It's important to note that the dosages of ginseng used in studies for ED vary widely, ranging from 600 mg to 3,000 mg per day. This variability highlights the importance of consulting with a healthcare professional to determine an appropriate dosage based on individual factors and the specific ginseng product being used. It's also essential to keep in mind that the quality and composition of ginseng supplements can vary significantly between manufacturers. Consulting with a knowledgeable healthcare provider can help ensure the selection of a high-quality, standardized ginseng product. Moving on to a more controversial option, let's discuss Yohimbine, an alkaloid derived from the bark of the African Yohimbine tree. Yohimbine has been used as a traditional remedy for sexual dysfunction, but its use for ED remains controversial due to potential side effects and limited regulation. Yohimbine works as an alpha-2 adrenergic receptor antagonist, blocking the effects of adrenaline and noradrenaline on smooth muscle cells. By reducing the constriction of blood vessels, Yohimbine may increase blood flow to the penis, facilitating erections. While some studies have suggested that Yohimbine may be effective for ED, its use is associated with potential side effects and safety concerns. Common side effects of Yohimbine include increased heart rate, elevated blood pressure, anxiety, and headaches. Yohimbine can also interact with various medications, including antidepressants, antihypertensives, and stimulants. These interactions can lead to serious adverse effects and may require medical attention. One of the main challenges with Yohimbine supplementation is the lack of standardization and regulation. Many Yohimbine supplements available over the counter may contain variable amounts of the active ingredient or be contaminated with other substances. The dosages used in clinical trials for ED vary widely, and there is no consensus on the optimal dose for safety and efficacy. Without proper medical supervision and standardized products, determining a safe and effective Yohimbine dosage can be difficult. Given the potential risks and challenges associated with Yohimbine, it's crucial to consult with a healthcare professional before considering its use for ED. In many cases, safer and more reliable treatment options may be available. In addition to the supplements we've discussed, several other natural remedies and herbs have been investigated for their potential benefits in managing ED. However, it's essential to note that the evidence supporting their efficacy and safety is often limited, and more research is needed to establish their role in ED treatment. Horny goatweed, also known as epimedium, is a traditional Chinese herb that contains acarian, a compound believed to have aphrodisiac properties. Some studies have suggested that acarian may inhibit the activity of phosphodiesterase type 5, or PDE5, an enzyme that regulates blood flow to the penis. However, the evidence for its efficacy in treating ED is limited, and more research is needed to determine its safety and optimal dosage. Tribulus terrestris is another plant that has been used in traditional medicine to enhance sexual function and libido. Some studies have suggested that Tribulus terrestris may improve erectile function by increasing testosterone levels, but the evidence is inconsistent. Additionally, the safety and long-term effects of Tribulus terrestris supplementation have not been well established. DHEA, or dehydroepiandrosterone, is a hormone produced by the adrenal glands that can be converted into testosterone and estrogen. Some studies have investigated the potential benefits of DHEA supplementation for ED, with mixed results. While DHEA may improve erectile function in some men, particularly those with low testosterone levels, its use is associated with potential side effects such as acne, hair loss, and increased risk of prostate cancer. While these and other supplements may show promise for managing ED, it's crucial to approach their use with caution. Many natural remedies and herbs have not been rigorously tested for safety and efficacy, and their long-term effects are often unknown. Additionally, the quality and purity of supplements can vary widely, as they are not subject to the same regulations as prescription medications. Some supplements may contain undisclosed ingredients or contaminants that can pose health risks. Before considering any supplement or natural remedy for ED, it's essential to consult with a healthcare professional. They can help assess the potential benefits and risks, consider possible interactions with existing medications, and recommend the most appropriate treatment options based on individual needs and medical history. Now, let's shift our focus to lifestyle changes that can promote and maintain healthy erectile function. Adopting a healthier lifestyle can not only improve ED symptoms, but also enhance overall well-being and reduce the risk of chronic diseases that contribute to ED. Maintaining a healthy weight is crucial for optimal erectile function. Obesity is a significant risk factor for ED, as it can lead to insulin resistance, hormonal imbalances, and endothelial dysfunction. A study by Esposito and colleagues in 2000 found that a Mediterranean-style diet rich in fruits, vegetables, whole grains, and healthy fats, combined with increased physical activity, led to significant improvements in erectile function among obese men with ED. Regular physical activity is essential for maintaining cardiovascular health, which is closely linked to erectile function. Exercise helps improve blood flow, reduce inflammation, and promote healthy endothelial function. A meta-analysis by Lamina and colleagues in 2009 found that aerobic exercise interventions significantly improved erectile function in men with ED. The authors suggested that regular exercise, such as brisk walking or cycling for at least 30 minutes per day can be an effective non-pharmacological treatment for ED. Managing stress levels is another important aspect of promoting healthy erectile function. Psychological stress and anxiety can contribute to ED by interfering with the brain's signals to the penis and causing blood vessels to constrict. A study by Hedon in 2003 found that stress management techniques, combined with lifestyle changes and counseling, led to significant improvements in erectile function and sexual satisfaction among men with ED. Quitting smoking is also crucial for improving erectile function. Smoking is a significant risk factor for ED, as it can damage blood vessels, reduce blood flow to the penis, and cause hormonal imbalances. A systematic review by Kovac and colleagues in 2015 found that smoking cessation led to significant improvements in erectile function, particularly among younger men and those with a shorter history of smoking. Lastly, adopting a nutrient-dense diet is essential for maintaining optimal erectile function. Consuming a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats can provide the necessary nutrients for proper blood flow, hormone production, and overall sexual health. A study by Esposito and colleagues in 2010 found that a Mediterranean-style diet, rich in antioxidants, vitamins, and minerals, was associated with a lower prevalence of ED and improved sexual function among men with metabolic syndrome. Incorporating these lifestyle changes into a comprehensive approach to managing ED can lead to significant improvements in erectile function and overall sexual well-being. However, it's important to remember that lifestyle changes alone may not be sufficient to address all cases of ED, particularly those with underlying medical conditions or more severe symptoms. In conclusion, while the best supplements for erections, such as vitamin D, folic acid, L-arginine, Ginseng, and Yohimbine, may offer potential benefits for managing erectile dysfunction, it's crucial to approach their use with caution and under the guidance of a healthcare professional. The evidence supporting the efficacy and safety of these supplements varies, with some, like vitamin D and L-arginine, showing more promise than others. It's essential to recognize that supplements alone may not be sufficient to address the underlying causes of ED, which can be multifactorial and involve both physical and psychological factors. Lifestyle changes, such as maintaining a healthy weight, engaging in regular exercise, managing stress levels, quitting smoking, and adopting a nutrient-dense diet, play a vital role in promoting and maintaining healthy erectile function. Before considering any supplement or natural remedy for ED, it's imperative to consult with a healthcare provider. They can help assess the potential benefits and risks, consider possible interactions with existing medications, and recommend the most appropriate treatment options based on individual needs and medical history. In some cases, prescription medications or other medical interventions may be necessary to effectively manage ED. Ultimately, a comprehensive approach that combines lifestyle modifications, targeted supplementation when appropriate, and open communication with healthcare professionals can lead to significant improvements in erectile function and overall sexual well-being. By prioritizing a healthy lifestyle and seeking guidance from qualified medical experts, men can take proactive steps towards enhancing their sexual health and quality of life. If you found this information helpful and want to learn more about optimizing your sexual health, be sure to visit nutritionmarket.com.au. At Nutrition Market, we offer a wide range of high-quality supplements and resources to support your well-being. You can also book a consultation with one of our clinical nutritionists or naturopaths who serve clients in Australia and around the world through our virtual clinic. Don't forget to hit the like button and subscribe to our channel for more informative content on health and wellness. And remember, while the information provided in this video is based on scientific research, it should not replace personalized advice from your healthcare provider. Some of the findings discussed may still be under investigation, so always consult with a qualified professional before making any changes to your health regimen. Thank you for watching, and we look forward to seeing you in our next video.